Good afternoon, everyone. My name is Kristen Wong Tam, and I'm the Vice Chair of the Board of Health. The Board Secretary has confirmed that we have quorum, so I would like to call meeting number 30 of the Board of Health to order. Welcome back, everyone. Today's meeting is being held with members of Council and City staff participating by video conference, as well as members of the Board. The public continue to participate electronically and can watch the meeting streaming live on YouTube at youtube.com/Toronto City Council Live. These measures are necessary to comply with public health regulations and prevent the spread of COVID-19. I will ask everyone for their patience if we are experiencing any technical issues or delay, and obviously we've already started with that. I want to recognize that we do have some registered speakers today, and the clerk's staff will have connected all registered speakers to the meeting by audio. The list of speakers can be viewed online by visiting the Board of Health's webpage at toronto.ca/council. You can click on the speakers box and you will see those names itemized there. The Board Secretary has also emailed the list of speakers to the directors. Directors, this is a paperless meeting, as you know. The Board Secretary has provided all agenda materials on the toronto.ca/council website, and it is also available through CMP, which is the clerk's meeting portal. Directors, a reminder, please keep your microphones on mute until you are ready to ask questions of staff or ready to speak to an item, and at which point in time, please turn on your video so it would be easier for all of us to see you, but also for myself as the chair to direct the meeting. As part of each gender item, I will ask the directors to please raise your hands or unmute your microphone when it's time for you to speak or to ask questions. I will then create a speakers list and will call on directors when it's their time to speak. When voting on an item or a motion, I ask that the directors ensure that you turn on your video and please raise your hand when asked to indicate your vote. Directors, I want to remind you that you must submit and approve your motions by email. The staff are available to support you at boh@toronto.ca. They are here to support you and help you with your motions. Although we are in different locations and meeting remotely today, the Board of Health would like to acknowledge that the land we're meeting on is traditional territories of many nations, including the Mississaugas of the Credit, the Anishinaabe, the Chippewa, the Haudenosaunee, and the Wendat people. Toronto is now home to many diverse First Nations people and Métis people. We also acknowledge that Toronto is covered by Treaty 13 with the Mississaugas of the Credit. I would like to also invite Peter Wong to provide us with further and I think a much more refined and robust acknowledgement. Director Wong, the floor is yours.
Thank you, Chair. As we meet today on this virtual platform, the Good Mind tells us that we would like to begin by acknowledging Indigenous peoples of all the lands that we call home. The land acknowledgement is an expression of gratitude and respect for the land, and one that has been practiced long before European settlers arrived on Turtle Island. So as we approach the National Day of Truth and Reconciliation, a day that honors the lost children and survivors of residential schools, their families, and their communities, let each of us recognize our obligation to participate in truth and reconciliation. Let each of us inform ourselves of the history of residential schools and the oppression and systemic racism in our schools. And let each of us find something that we can do to continue the dialogue on reconciliation, such as let's talk to our children about reconciliation and ensure that they are aware. And we acknowledge the lands that Chair has already done, Megwich. Thank you, Chair.
Thank you very much, Director Wong, for that acknowledgement and for helping us open our proceedings in a very good way. Open heart, open mind, open ears. Are there any declarations of interest under the Municipal Conflict of Interest Act? If you have an interest, please raise your hand and unmute your microphone, and then indicate the item number of the agenda that you want to speak to and the nature of your interests. Seeing none, we will proceed. Can I please have a motion to confirm the minutes from our last board meeting on June the 14th, 2021? Thank you very much, Chair Cressy. All those in favor? Any opposed? That carries. Thank you. So let us proceed now to the agenda review. We have a number of items on the agenda, and there are 2 additional new business items. So that brings us to 7 in total. The first item on the agenda is HL 30.1, Response to COVID-19 September 2021 Update. There's obviously a staff presentation once Dr. Davila is able to join us. There's also a number of registered speakers. We will hold that down and dispense with it shortly. We'll move on to item number 2. HL 30.2, Advancing the Implementation of the Toronto Indigenous Health Strategy at Toronto Public Health. I believe there are also speakers on this item. Is that correct, Clerk? But we will still need to hold it down for a staff report.
Yes, Ms. Vice Chair, I can confirm that there are introductory remarks on this item from the Medical Officer of Health and 2 other staff. So if you could hold that, that would be great.
Yes, thank you. I will hold that. Thank you. Item number 3, HL 30.3, Toronto Public Health Budget Variance, 6 months ended June 30th, 2021. There's a staff report with a recommendation. Would anyone like to hold this item? If so, please raise your hand and I can acknowledge you. Okay. Seeing none, I would like to move the, Chair Cressy has moved to adopt the recommendations of the report. All those in favor? Any opposed? That carries. Thank you. Item number 4, HL 30.4, Toronto Public Health Capital Budget Variance, 6 months ended June 30th, 2021. There is a staff report with recommendations. Would anyone like to hold down this item? Please indicate. Seeing none, can I please have a mover to adopt the recommendations? Councillor Director Ainsley, all those in favor? Any opposed? That carries. Thank you. Item number 5, HL 30.5, Association of Local Public Health Agencies, ALPHA's September 2021 update. We are going to be receiving a verbal update from Director Kate Mulligan very shortly, so we'll hold that item down for Director Mulligan. The next item is a new item business, 2021 Board of Health resignation and appointment to Association of Local Public Health Agencies, Board of Directors, and the Board of Health section. I'd like to introduce this new business item for the agenda, and all those in favor? Any opposed? That carries. We'll let the clerks circulate those items. And those items have been added to the agenda. And you will be able to see those items on the CMP portal. That's where those items will be. The next item is another new business item that has to be introduced, the request for a review of the health impact assessment for the Ontario line. I will introduce this new item for the agenda. Sorry, thank you. Thank you. All those in favor of introducing this new item, please indicate your support. Thank you. Any opposed? That carries. That will also be circulated. Thank you very much. Okay, that brings us to the end of our order paper. Has Dr. Davila joined us yet? Or should we go to item number 2?
Ms. Vice Chair, we do have... Oh, go ahead, Nahom.
I was just going to say that to the chair, this is the host. We have connected Dr. Davila by phone, so she should be able to speak. Dr. Davila, if you are present and can hear us, can you please indicate?
Yes, can you hear me?
We can, thank you.
Yes, I apologize. We seem to be having some extreme technical difficulties today, so we have tried several different solutions. This seems to be the most expeditious one at this time, so I do apologize to you, Madam Chair, and members of the board. And my
Not-
thanks to clerks and the host for continuing to work with me for quite some time now to try to get me into the meeting properly.
Well, we're glad you're here, Dr. Davila. The floor is yours when you're ready, and I think staff will be working your slides for you as well.
Yes, so we're, thank you again, Madam Chair, and just thinking through to everyone here, thank you for your patience. Colleagues, I will thank you, Kayla. I know you are driving the slides for me today, and so we'll try to do this in a somewhat a little disjointed, so I do apologize for this. We'll do our very best to get you through this presentation. So here we have, this is in respect of our response to COVID-19, September 2021 update. And let's go to the next slide so you have a sense as to what the presentation will cover. So in this presentation, I will provide you with an update on our COVID response, focusing primarily on 4 key areas. First, I will provide a high-level summary of the status of the COVID-19 situation here in Toronto. From there, we'll look at the Team Toronto vaccination efforts and updates on vaccination policy. And finally, I will end the presentation with an update on the support that Toronto Public Health staff have been providing to our school board partners and to schools themselves as they seek to create environments that optimize student learning in the midst of a pandemic. Next slide. First section of the presentation focuses on the status of the COVID-19 epidemic in Toronto. Turning to the next slide, you'll see the latest version of what is now a rather familiar view, I expect, to the members of the Board of Health, the monitoring dashboard. And this is the most current data that we have at this point in time, largely from last week. As you'll see that with respect to new COVID-19 cases, our 7-day moving average, top left of the slide, is sitting at 143. When I look at our data that is ever so more recent in the last few days, we're now looking at a 7-day moving average now at 132. We do see that the weekly incidence rate, that's the top middle of the slide, is sitting at 35 per 100,000 population. And we're seeing new hospitalizations continue with a 7-day moving average of roughly 5.3. We do see a little bit of an increase in respect of daily COVID-19 outbreaks in health institutions. That's the middle left of the slide, currently sitting at 6. Our reproductive number, that all-important number that we're following, as we know, we prefer to see this number below 1, as that's an indication that the outbreak is slowing. 1 means that it's holding steady, and of course, greater than 1 means that the outbreak is growing. Our current reproductive number is just below 1, as you can see here, and obviously our interest is in making sure that we drop that number as much as possible. Finally, the last point that I'll raise is that our percent positivity in respect of COVID-19 tests is now sitting at 2.7. So we are seeing some degree of stability over the last couple of weeks in respect of our monitoring dashboard overall. Just by way of reference, from the June 14th Board of Health meeting, just to give you a sense of how things have changed over time, the 7-day moving average in cases back on the 14th of June was 161. New hospitalizations was sitting at 11.1. And the reproductive number at that time was 0.75, with the percent positivity on tests sitting at 3.5 at that time. Turning to the next slide, what you will see is what modeling suggests may happen here in Toronto in terms of number of cases. At the top of the slide in front of you are the case projections derived from the modeling effort using data up to mid-August. In mid-August, the model projected that if transmission stayed at the same level that it was at that time, with a reproductive number sitting at 1.28 back then, we could expect to see approximately 600 cases a day by the beginning of December. This was particularly concerning, as you can well imagine, from our perspective, because we knew that if transmission were to increase, for example, from that time by 20%, which is what we had anticipated might happen with the opening of schools, we would expect to see over 4,000 cases daily by the beginning of December. However, the model has now been updated with more current data, and that you see at the bottom of the slide here in front of you. And now, using data up to September 18th, the model projects that if transmission stays the same at the current level, then we'll likely see approximately 130 daily cases by the beginning of December. I should point out to members of the board that this does not yet fully capture the impact of schools reopening, and this will not be captured in the data for yet another 1 or 2 weeks more. Furthermore, important to note that a 20% increase in transmission compared to where we are now would be expected to result in approximately 600 daily cases by the beginning of December. So, compared to where we were about a month ago, the case projections have clearly improved, and we have seen a drop in transmission. We cannot be completely certain of all the reasons why we've seen this drop. However, we can surmise that it is due in large part to our ongoing vaccination efforts, but also a reduction in the risk of infection when people come into contact. For example, through measures that people adopt, like the wearing of masks and physical distancing. These efforts, vaccination, and continuing to adopt these practices, these public health measures, will continue to be important as we proceed in the days ahead. Turning to the next slide, this is the component of the presentation where we will provide you an update on the vaccination campaign. And what's depicted here on this slide are data as of September the 23rd, so towards the end of last week. But just before this meeting, I received word from our amazing colleagues at the epidemiology team advising us that as of 8 o'clock this morning, that 85.6% of Toronto residents 12 years of age and older now have at least 1 dose of vaccine. And they have also advised that we have crossed the 80% mark on eligible Torontonians who've completed vaccination, the exact figure being 80.4%. I can't stress enough to the board what a remarkable achievement this is. 80% of eligible Torontonians, more than 80% of eligible Torontonians having completed their vaccination in this period of time, the largest vaccination campaign ever in the history of this city, and certainly a remarkable achievement in terms of the proportion of the population who is eligible and is now covered by the protective benefit of vaccine. Turning to the next slide, just a little bit further by way of moving towards that target established by the province in light of the Delta variant. Knowing that the Delta variant is that much more transmissible, the province has established a target of moving towards 90% fully vaccinated. And as you can see, even as we are in this last mile, as the province calls it, of the vaccination efforts in the province, and that includes here in the city, and therefore uptake of vaccine is perhaps not as swift as it was earlier in the vaccination campaign, we do continue to see steady progress towards that 90% goal as established by the province for those who are eligible and fully vaccinated. As of September 23rd, there are 278,000 people that have yet to be vaccinated in order to reach that figure, and of those, we know that 147,000 have already had 1 dose. Next slide. So we know that we're continuing to work, we'll go to the next slide, on making sure that we're doing everything we can. We know that millions, as you've seen by the numbers and the data that I've just presented to you, millions of Toronto residents have already rolled up their sleeves and done their part to help combat the spread of COVID-19 by getting vaccinated. And so with the goal of getting vaccination rates as high as we can in order to ensure the greatest protection is provided to the greatest number of people, we at Toronto Public Health and our vaccine partners are focused on making vaccines as accessible as possible. and have adjusted our strategy to bring clinics to areas where Torontonians live, work, and play. We're also working with vaccination partners to provide third doses of vaccine to those who are deemed eligible under the current provincial policies. And we're supporting residents who've been vaccinated elsewhere, ensure that their vaccine doses are appropriately recorded within the provincial system. Turning to the next slide, a little bit more by way of detail on our hyper-local vaccination strategy. So together, the City and Toronto Public Health continue to operate 5 vaccination clinics with the capacity for over 12,000 vaccine appointments per week. In order to augment these efforts and make the vaccine as accessible as possible, we've also launched a hyper-local vaccination strategy. And this strategy is focused on bringing vaccination clinics to workplaces, to retail spaces, TTC stations and stops, places of worship and faith groups, schools, post-secondary institutions, childcare facilities, and other public spaces, all in an effort to reduce as many barriers as we can to vaccination. Some specific recent initiatives have included the Days of Vaction, which saw almost 7,600 doses administered at 92 clinics across the city between September 16th and September 19th, and most recently, the Shop and Vax effort, which brought COVID-19 vaccines to local shopping centres just this past weekend. Based on our data, Toronto Public Health will continue to work with partners, including Ontario Health Teams, family doctors, pharmacies, and community ambassadors, to expand public education efforts and encourage those who are vaccine hesitant to get vaccinated. This includes holding vaccination clinics in areas of the city and for populations and communities where such clinics are needed the most, and promoting vaccines through channels that are most likely to deliver the desired outcome. Turning to the next slide, some information on the vaccination engagement teams. This program is led, with great thanks by our colleagues at the Social Development, Finance, and Administration Division, and we certainly work in partnership with them doing this work. It aims to enhance vaccine equity measures to support equity-deserving groups that are disproportionately impacted by COVID-19. These vaccine engagement teams operate through 14 geographic and population-based consortiums made up of more than 155 health, community, and faith-based organizations, and use a variety of approaches to increase vaccine confidence and access. Activities of the teams include such things as vaccine education and awareness building campaigns, targeted outreach strategies, and mobilization of more than 200 multilingual community ambassadors. I'm sure you'll be pleased to hear that this program is currently being evaluated, and we anticipate that preliminary results will be shared with the Board of Health next month. Next slide. Now turning to the component of the presentation focused on vaccination policy. Next slide. You'll have probably heard and maybe even have seen stories of the experiences of jurisdictions the world over. And from those experiences, we know that vaccine certificates or passport programs are measures that can help reduce the spread of COVID-19 through increasing vaccine uptake. They are in effect in many provinces, including ours, where a vaccine certificate program came into effect, as you likely heard, on September 22nd. So under the current provisions of the program, Ontarians need to provide proof of full vaccination along with personal identification that includes their name and date of birth to access certain non-essential and higher risk public settings and facilities. For example, bars and restaurants, gyms, and indoor meeting spaces, to name just a few. Important to note that these requirements do not apply to settings where people access essential goods and services, such as medical care and food and groceries. Individuals who have a recognized medical exemption and children under the age of 12 who are not yet eligible to receive the vaccine are exempted from the program. And just by way of reminder for members of the public who may be joining us, individuals can download their proof of COVID-19 vaccination at covid19.ontariohealth.ca. The province has announced that it will launch a digital vaccination certificate in a smartphone app on the 22nd of October to facilitate the verification process. And it's our understanding that that app, the verification app, will only provide an individual's name and their vaccine status. Until the app is launched, individuals will need to show a paper or PDF receipt along with their own identification. And those with a recognized medical exemption will need to show a note from a doctor or a nurse practitioner. Important to note as well that paper records will continue to be accepted even after the launch of the provincial app. And finally, as one of their latest contributions to the COVID response, our colleagues at Toronto Public Library are offering free printing of vaccination receipts at all library branches across the city. And so with that, I would just like to offer my thanks to our colleagues at Toronto Public Library for their continued support, as they've been a great support throughout the entire pandemic. Next slide. The province has also announced that certain employers in healthcare, childcare, and educational settings are or will be required to have COVID-19 vaccination policies for their staff. And we at Toronto Public Health made a strong recommendation a number of weeks ago that local employers institute workplace vaccination policies, in keeping with employers' legal obligations to take measures to promote occupational health and safety in their workplaces. And this includes, of course, protecting employees from the transmission of disease. As such, we have and we continue to provide resources to help employers create workplace vaccination policies, and these resources are available on the city's website for those who are interested in getting access to those resources. And as you've likely heard through the media, a wide range of employers has introduced mandatory vaccination policies for their employees, including hospitals, universities, the provincial and federal governments, and a number of private businesses. And finally, I would just make note of the fact that the City of Toronto itself has effected a policy that requires all employees to receive 2 doses of a vaccine by October 30th of this year and to provide proof of vaccination. Exemptions to that are assessed on a case-by-case basis in accordance with the city's policies and legal obligation. Next slide, please. So with respect to the opening of schools, and first, let's go to the next slide and have a look at what we are seeing by way of case rates amongst the younger set in our community. So while the overall case rate, as you might recall from the initial slide that I presented in this presentation, the overall case rate in Toronto has been holding relatively stable for the past few weeks, hovering in and around the range of about 35 cases per 100,000 population per week. However, case rates have increased in the 4 to 11-year-old age group in the most recent 3 weeks. In the most recent week, this age group had the highest reported case rate at 64, just over 64 per 100,000, an increase from 57 or so per 100,000 in the previous week. Important to note that this is the first time that the case rate in this age group has been the highest out of all the various age groups since the start of the pandemic. Not especially surprising, though, given that this age group is currently not eligible for vaccination. I think, interestingly, it's important to note that this finding does point to the effectiveness of vaccines. Looking, however, at the top right of the slide, there's a box there. It is important to note that at this point, what we are seeing is that the majority of cases in children to date are sporadic. So, even as school has started, we're seeing at this point that few are linked to outbreaks. And in fact, what we do see is that the most common source of infection at this time amongst children is household transmission. So with that in mind, the most common source of infection amongst children being household transmission, I think it's important for the board to recognize that it is absolutely key for parents to get vaccinated to help ensure the safer reopening of schools and the ability to provide ongoing in-person learning. Next slide. Unfortunately, we know that there is still some work that has yet to be done in terms of vaccination amongst those in that 30 to 49-year-old age group, which we can use as a reasonable proxy for parents with school-age children, particularly those who are not old enough yet to be vaccinated. For Torontonians aged 30 to 49, approximately 237,000 are not fully vaccinated. That's about 25% of that age group. And our data suggests that roughly about 190,000 have not yet received a first dose. So I think, I tend not to speak too much to the board in the form of individual stories and anecdotes. But if you'll indulge me this once, I think it's helpful to understand how important the vaccination of parents and caregivers is in terms of protecting children who are not yet eligible for vaccine, and in terms of supporting in-person learning. And this recent sort of anecdote or case that we encountered here at Toronto Public Health perhaps helps to illustrate this in a way that the numbers and charts might not be able to do. So looking at this specific example I'd like to tell you about, we have a case, a COVID-19 case, who is a Toronto resident and a parent to 3 school-age children. After showing some symptoms consistent with a COVID infection, this parent sought testing, and the testing came back positive. After receiving that positive test result, the next day, the rest of the household, which included another adult and 3 school-age children who were all asymptomatic, they were all tested, but were found to be positive for COVID-19. So, what was challenging in this particular circumstance was that the other adult was not vaccinated for sure, and there was one of the children who was old enough to be vaccinated was not vaccinated. All 3 children in this case were participating in in-person learning at 3 different schools. And while the children did not attend school after testing positive, they all had attended school during their period of communicability. And as a result, all 3 of their cohorts were dismissed. This meant that there were 3 school cohorts, roughly 60 children, who required self-isolation for 10 days and had to be moved to online learning. On the plus side, as of the end of last week, no additional cases were identified in the school cohort. So what does this tell us? What does this anecdote or this particular situation help us to understand? Well, first and foremost, it tells us about how one unvaccinated caregiver did lead to additional cases, 4 additional cases to be precise, within their own household. We also know that, having unvaccinated caregivers with these exposures in the household further led to disruption in 3 separate classrooms at 3 different schools, affecting approximately 60 children. It certainly highlights the importance of vaccine for those who are eligible, especially those who are in regular and direct contact with school-age children, both in terms of protecting the individuals within the household themselves and in terms of keeping school disruptions to a minimum and ensuring that as many children as possible in our community are able to benefit from the in-person learning environment as much as possible. And, I think the other final piece here that's worthy of your reflection is that this does show the importance, I think, of strong infection, the benefit of strong infection prevention and control measures, including mask wearing within the context of the schools, given that thus far we have not seen further transmission, and we're grateful for that. Turning to the next slide. We're almost at the end of the presentation. Just to give you a summary as to what kinds of supports are being provided by Toronto Public Health for schools and school boards within our community. We certainly are supporting our elementary and secondary schools through the investigation of cases and managing outbreaks, providing education on vaccine, ensuring that people understand testing and how best to do and what circumstances warrant that. And we certainly are working with our various health system partners to support, a lower barrier take-home testing kit program and providing guidance on when that might be used. We, of course, are also providing support to schools with respect to implementing provincial guidance as that is issued to schools across the province, whether it's related to infection prevention and control, screening, different other protocols, physical distancing, and of course, promotion of the vaccine. Next slide. So this is the final slide of the presentation. And if I may, I would like to offer members of the board a few reflections on the COVID response thus far. I could hardly believe it myself when, in preparing for this meeting, I calculated that it has been 612 days since that first COVID-19 case was identified here in Toronto back in late January of 2020. And, looking at our COVID response in Toronto, to provide you with only a few examples of looking at that response by the numbers. As of this past Friday, September 24th, Toronto Public Health staff have responded to 177,925 cases. They've investigated more than 2,600 outbreaks. They've conducted 16,656 compliance checks and addressed 292,053 telephone inquiries through our hotline. All of this and so much more, thanks to the approximately 2,800 skilled, caring, and dedicated people at Toronto Public Health that I'm privileged to call my colleagues. My colleagues who have been called upon time and time again and have been going essentially nonstop for 612 days. 612 days in, and unfortunately, there are many more to go yet before we can truly rest. In the days that lie ahead, we have cases and outbreaks to manage, people and organizations to advise, counsel, and support, and COVID vaccines to administer to protect the vaccine hesitant, to provide third doses, and hopefully soon to protect those 5 to 11 years of age. And this is just to speak of the COVID-focused work. In the coming weeks, we have the annual influenza vaccination program to administer, plus all the other areas of public health practice and programming where needs have not only continued, but increased, both in demand and complexity over the course of the pandemic. In a situation as demanding and as complex as this has been and continues to be, the response would simply not be possible without the cooperation and collaboration of many, many partners. In fact, too many to name one by one. There are colleagues throughout the city and its various divisions, healthcare and health system partners, community agencies, and the people of Toronto themselves. To one and all, on behalf of the entire team at Toronto Public Health, thank you. And to the remarkable team of people that comprises Toronto Public Health, although it never feels like enough, I will continue to offer my sincere, deeply heartfelt, and undying thanks. I know that you are beyond exhausted, and for some of us, beyond burnout. I also know that somehow, you collectively continue to find the strength to serve the people of this city. This is truly, truly inspiring. And I think something of which the Board of Health and the entire city can be truly, truly proud. I know that I most certainly am. So with that, Madam Chair, I will wrap up the presentation and hand it back over to you.
Thank you very much, Dr. Davila, for your presentation. Very, very good to hear from you, as always. We will hold the presentation down for questions of the board. We will come back to that as soon as we can. We do have some registered speakers. To those who are on the line, I would like to just put something on the floor because it's been made aware to me that we're probably going to lose quorum at 5 o'clock, and we need to absolutely make sure we get through the agenda. So my apologies to all. I'm going to be moving a motion to reduce your speaking time from 5 minutes to 3 minutes. And of course, this is not the intention, but I do recognize that we can't lose quorum of the board as well. So the clerks have prepared a motion for me. If I can just have that put on the screen, we're just simply reducing the speaking time. And
yes, Ms. Vice Chair, we're just getting that up on the screen in just a minute here.
Okay. Thank you very much. The motion reads that the speakers who have not pre-registered be allowed to speak until 2:30 on September 27th, after which no further registrations are allowed and the speakers list will be closed, that the length of public presentations will be limited to 3 minutes. This is all in order for us to hold on to quorum. All those in favor of the motion, any opposed, that carries. Okay, so we'll have to get on with it then. I do have the speakers list. Sorry, folks, I'm working from multiple screens. If you can just be patient with me. I would like to call our first speaker. And just as we oftentimes do, just remind the members of the public that there is a procedural bylaw, section M40 subsection 4, that specifically states that the public presenters to this board must not speak disrespectfully about anyone. Please do not use any offensive language. I'm sure none of you will, of course. Speak only about the subject on which the board has invited them to make a public presentation on. And of course, please obey the procedural bylaws and any of the chair's ruling. These are rules for all of us. And so we will go from there. Our first speaker, I'd like to call Derek Moran. Derek, if you can hear me, the floor is yours, and the clerk will begin your clock when you're ready.
Can you guys hear me?
Yes, we can, Derek. Go ahead, please.
Okay, I'm just going to start my clock. First of all, I just want to make an objection. Like, there's only 7 speakers on the speakers list for like the whole meeting, and like 5 o'clock is almost 3 hours away, so that should not have been done. But I just want to say, by me speaking at this meeting, this shall not be deemed to be in any way my consent expressed or implied. In doing so as fraud, God bless Her Majesty the Queen, and long live Her Majesty the Queen. So in this report, it says, the COVID-19 vaccine has been shown to reduce virus transmission. So I don't think that's actually true, because in my written presentation, I provide a link and a screenshot from the CDC. Actually, it's a statement from the CDC director who said that high viral loads suggest an increased risk of transmission and raise concern that, unlike with other variants, vaccinated people infected with Delta can transmit the virus. So in this report, it also says the Ontario COVID-19 Science Advisory and Modeling Consensus Tables, the science table, release projections forecasting a substantial 4th wave. For those who aren't aware, that first time the province of Ontario announced their COVID modeling results back at the beginning of all this was from a doctor named Peter Donnelly, who's no longer there, who mentioned, and I provide the YouTube link in my written presentation, where he says, as Steiny, I guess he's talking about Dr. Steiny Brown, has correctly pointed out, projections and modeling of a brand new viral disease are very inexact. Notice he didn't just say inexact, but he said very inexact. And again, I have in my written presentation the YouTube link where Dr. Davila explains to David Ryder of the Toronto Star that science is a very careful process, and it does rely very heavily on peer review and ensuring that appropriate methodology is being followed before you can actually land particular conclusions. So modeling is not based on science. It's fancy guesswork. If anything, it's junk science and should be rejected as such. So this report also says emerging epidemiology and evidence demonstrate that due to the presence of and high transmissibility of the Delta variant, individuals who are not vaccinated and putting their own health at risk. So I got about 30 seconds left. I've got two links and screenshots from the Public Health of England's own data. One basically says that the Delta variant has a case fatality rate of 0.1%, that's a survival rate of 99.9%. And another link I found out that those who are double vaccinated are 4 times greater of dying of the Delta variant than those who are unvaccinated to begin with. And I guess that's my 3 minutes, I guess.
Derek, thank you very much for your comments. I would just turn over to the board. Are there members with questions of the speaker? Seeing none. Derek, thank you very much for your time today. We appreciate you coming in. Our next speaker is Olivia Fountain. Olivia, if you can hear me, it is your time to speak. The clerk will begin your clock when you're ready.
Hi, can everyone hear me?
We can, thank you.
Good afternoon, everyone. Thank you for having me. I'm ready to begin speaking. The healing comes from nature and not the physician. Therefore, the physician must start from nature with an open mind. Paracelsus. At the ending of the year 2019, the coronavirus entered Canada, causing many to fall ill. During that time and presently, many were told to self-isolate for 14 days without receiving guidance from official health advisors for this pandemic on ways to remedy themselves at home. Rather, those infected with COVID and those not infected with COVID were advised to wash their hands frequently, social distance, and to keep the bottom half of their faces covered with masks. Though these actions played a role in keeping people safe and protected, many died from and/or suffered from the effects of the virus while waiting on vaccines. It is during this time that I believe we not only already had remedies to aid those infected, but a collective of people with the knowledge, skills, and expertise were not consulted by their nation's governments, the BOH, the FDA, and WHO to help battle this pandemic. These groups of people I speak of are herbalists, professional practitioners of plant medicine. Plants have been used for centuries to battle a variety of ailments, viruses, and diseases. It is in fact the chemicals in the plants that many drugs have been synthesized from. In 1897, a chemist by the name Felix Hoffmann extracted salicylic acid from the plant Philopendula ulmaria, and through a series of chemical processes, formed the drug known as aspirin. It is no secret that many pharmaceutical companies observe the chemistry in plants, extract its active ingredient, and then synthesizes the chemical with other organic materials to create their own drug that can be patented and sold. Plants have been on planet Earth evolving not just for the sake of doing so, but to provide us with not only a source of oxygen, but powerful medicine that can be used to not only fight the coronavirus and its variants, it can also be used to help protect the body from foreign invasion, future outbreaks, and assist the body in healing a variety of other health-related issues with minimal to no side effects when kept in its pure form. The chemicals found in plants carry out a series of physiological functions that have the ability to perform better in the body, for the same elements found in the earth can be found in the human anatomy, and it is the earth from which plants also extract what is necessary for their evolution and survival. The human race is dependent on nature for all of its needs. As the great physician Hippocrates said, the physician treats, nature heals. Canada has presented their people with one option: receive the vaccination or be isolated from a series of activities that makes one feel a part of their country. I believe that in the universe filled with infinite possibilities, to provide a nation of people with only one is not only an ultimatum, but disregards years of research and studies around plant medicine that can be used in this pandemic. There are those who cannot take the vaccine for various reasons. There are those who are concerned about the long-term effects after receiving one shot at the vaccine, but multiple. There are children who cannot be vaccinated.
Olivia, I apologize. Your time is up. Can you give us one final thought?
I would just like to say that herbal medicine should as an alternative option because the science proves that it has the ability to protect us from viruses and to eliminate any type of pathogens or diseases that will try to infect the body.
Thank you very much, Olivia. Are there any members from the Board of Health who have questions of the speaker? Seeing none, thank you, Olivia, for coming in to speaking with us today. Our next speaker is Margot Boyd. Margot, if you can hear me, we'll begin your clock once you're ready.
Can you hear me?
We can.
Hi,
thank you.
Ms.
Hello.
Longtime, can you hear me?
Yes, we
Okay.
can.
Okay. I'm actually over the phone. I had to switch. Okay. So my name is Margot Boyd. I have a postgraduate degree in health sciences from what's now known as the Dell Atlantis School of Public Health at U of T. My area of interest was determinants of health, and I grew to understand the imperative that policy be data-driven and evidence-based. During the 90s, as a young graduate, I had re-stint as an intern at the Ministry of Health and then worked at 3 different hospitals on University Avenue. I'm speaking to you today because over the past months, I have observed an increasing gulf between what the data is telling us and our COVID-19 policy. As we know, these mRNA vaccines are not traditional vaccines and that they neither confer immunity nor stop transmission of the coronavirus. It should be made perfectly clear that Health Canada has approved 2 products, Comirnaty and Spikevax, neither of which is actually available in Canada. Thus, the City of Toronto is recommending people unknowingly receive unapproved, emergency use only substitute products that have no product liability associated with them. Will the city be liable for damages to those who become injured by the emergency use vax products that are being advertised as approved by Health Canada? Have you made City Legal aware of this potential liability issue? On to myocarditis. The cardiac impacts of these spike protein vaccines have risen to concerning levels with an increase in incidence of myocarditis post-mRNA injection, most notably in adolescents and young adults, especially in young male athletes. This population typically has a very rare incidence of this type of disease, as typically these patients are older with hypertension, coronary heart disease, and heart failure. In June 2020, pathologist Roger Hodgkinson, who was asked about the risk of myocarditis following the COVID vaccine, stated, "Myocarditis is never mild, particularly in young, healthy males. It's an inflammation of the heart muscle, the pump of the body. Heart muscle does not regenerate. We do not know how many heart muscles have died. Long-term results are utterly unpredictable. We do know that myocarditis can present in later decades with premature onset of heart failure that would otherwise not have been expected. It is not trivial." We now see media battling each other about the incidence of myocarditis. Has the conversation really now become about what is the right amount of myocarditis for kids? In spite of efforts that have been made to trivialize this vax adverse event, there's no such thing as myocarditis light. Dr. Ioannidis and Axford at Stanford in the U.S. put the COVID infection survival rate for those aged 0 to 19 years at over 99.99%. And age 20 to 29 years at over 99.98%. In Ontario, where is a single pathology report for a child who has died that shows the cause of death was COVID? The death rate for COVID is 0. So we haven't even got a single case for a prophylactic treatment. There's no risk to be reduced. Further, why would a vaccine associated with heart damage be given to a child who is already COVID recovered, or otherwise immune to C-19? Putting a young, healthy heart
Margot,
in danger. Yep. Sorry. I was just reading because I have 5 minutes worth of text here. So
That's okay.
I understand that you're cutting us off at 3 minutes.
Yes, I am, and I apologize for that. Would you like to give us one quick final thought? I didn't mean to cut you off, but I did want to alert you to the time.
Well, thank you for asking. I guess it's the issue of informed consent because, as we know, that most kids can't even pronounce myocarditis, and so if they don't understand what it is or can't pronounce it, how can they really be capable of giving informed consent? So I don't envy your task today in making this decision, but I would ask perhaps that you ask Public Health to report back with a more comprehensive report that includes data that's necessary for a proper risk-benefit analysis to keep the hearts in our children safe and which promotes informed consent.
Thank you very much. Are there any questions of the speaker? Seeing none, thank you. Thank you, Margot. Our next speaker is Kelly Brown. Kelly, can you hear me? If you can, we'll start your clock when you're ready to speak.
Can you hear me?
We can. Go ahead. Yes, we can. Go ahead, please.
Okay, thank you. Chairs Wong, Tam, and Cressy, members of the Board of Health and City Councilors, Medical Officer of Health, Dr. Davila, members of the media, fellow attendees. My name is Kelly Brown. Thank you for the opportunity to speak with you today. I had spent much of the weekend preparing and compiling data from Public Health Ontario regarding post-vaccine myocarditis incidents in young males. But the length of my presentation was scheduled to be 5 minutes, and there is no possibility of me to effectively present the work that I had done in the time allotted, which is now changed. So I will thank you and hope to speak with you another time.
Thank you, Kelly, and I apologize that we had to cut the time short. You do have 2 minutes and some left if you want that.
No, the research that I put together was done on the understanding that the time allotted would be 5 minutes, and so it just simply is not worth it today. Thanks.
Okay, thank you, Kelly. And just to all their speakers, I do recognize that you've provided us written submissions. Those written submissions are posted, and the board of directors can also review your written submissions, which are oftentimes longer than the verbal ones. Our next speaker is Donald Walsh. Donald, are you there? Can you hear me?
Device. This is the host. It appears that Donald Walsh has now connected their audio. I am now unmuting the speaker's mic.
Thank you. Go ahead, Donald, when you are ready. 3 minutes,
Okay.
please.
Great. Thank you, everyone. Pleasure to be here. My name's Don Welsh. I'm a professor of physiology at Western University, and I specialize in cardiorespiratory biology, and I'm currently the Robart Chair in Vascular Biology. And I'd like to take a small portion of your time today to provide you some broader context. And it really relates to the lungs. They're responsible for gas exchange. It's where blood is oxygenated and waste products are removed. Now, most of you are well aware of respiratory viruses. There's about 200 in circulation. They often lodge in the lung. They can initiate infection, and they can interfere with gas exchange. And it's in a small number of cases, they will spread to the body where they'll elicit life-threatening conditions. This occurs primarily in the old and the infirm. Now, just to point out, viral infection in the lung occurs 24/7, 365. Most of you barely notice because you have a robust immune system. Now, the severity of respiratory viral infection is age and risk stratified. Thus, vaccines are deployed in a similar manner. This is consistent with the principles of precision medicine and aligns with Ontario's deployment of about 4 to 5 million flu shots per year. Respiratory vaccines are not true vaccines in the sense of blocking infection, disease, and transmission. They're better viewed as therapeutics, which moderate disease. And it should also be further noted that they do this in a time-limited fashion. So they're not like a magic cure-all. So COV-2 is a new coronavirus strain, and it follows the same stratified pattern, even more so. Now, the Canadian data notes that a pre-existing co-immunity in most people and those infected with COV-2 develop durable immunity. Children and young adults are of exceedingly low risk, and they are poor transmitters of disease as acknowledged in the literature. And this is through the continuance of school in countries like Sweden. So this brings us to youth vaccination and the generation of COV-2 vaccines. Given their exceedingly low risk of hospitalization and death, more so than the flu, the rationale for mandatory vaccines is quite weak and counter to the principles of precision medicine and respiratory vaccine deployment. This justification is further weakened by a lack of a detailed safety record. And this sort of one-size-fits-all approach to vaccination is unprecedented for what we call leaky vaccines. And there are unintentional consequences, one of which was just recently discussed, which was the high prevalence of myocarditis and pericarditis in young males. So I realize time is short, and there is decidedly more nuance to my arguments than presented. And in this regard, I just extend an open invitation to all to discuss the topic in greater detail. And I'm available for any time that fits your schedule. So thank you.
Thank you very much, Professor Walsh. Are there any members of the board with questions of the speaker? Seeing none. Professor, I have a quick question for you. I don't understand what you mean when you say leaky vaccine. What are you specifically speaking about?
Right. So kind of a traditional vaccine, something that we think of in the back of our minds is it's an agent, a biological agent that blocks the infection process, blocks the disease process, and then also blocks transmission. Now, respiratory vaccines, and that's what we sort of call them, they don't effectively block either the infection or the transmission over long periods of time. What they do is they tend to moderate the severity of the disease. And because they don't do all three of those, we tend to call them leaky. And that leakiness has consequences into the future. It can often promote variant development or mutations. And those mutations can often get around the normal, let's say, viral defenses of your body or induced by a vaccine.
Just so I have a better understanding, are all vaccines leaky?
No, not necessarily, just some. So the respiratory vaccines are generally what we call leaky. Why you tend to go for a flu, what we call shot every year. We use the word shot, not really vaccine, because they're more of a therapeutic. So it is a particular conundrum with respiratory vaccines. And it's because the route of entry is through the air, goes to your lung, where a lot of other vaccines, infections or diseases, communicable diseases, don't use that route of entry.
My final question is, what's the difference between therapeutic and vaccine then?
Right. So a vaccine is, so think of something like a smallpox vaccine, which is something that probably sits in everyone's mind. And this is where we literally wipe out the entire process of infection. So the initial infection, we don't see the subsequent disease and we don't see its transmission. So we literally take it out. And it's why we've sort of eradicated the disease on Earth. But in the case of a respiratory vaccine or therapeutic, because we only target the disease, what happens is the infection and the transmission can continue. And you'll see that with COVID.
Thank you very much, Professor, for your deputation. I have no further questions. Thank you. Our next speaker is Paul E. Alexander. Paul, if you are here, please unmute yourself and we'll restart your clock when you're ready. Paul Alexander, are you here? Okay.
This is the Vice Chair. This is the host. It does not appear that Paul E. Alexander is present.
Okay. Thank you very much. Mariko Uda, if you are here, please unmute yourself and we'll look forward to your presentation.
I'm here. Can you hear me?
Yes, we can. Go ahead, please.
Okay. Dear members of the Toronto Board of Health, I'm a Toronto resident and would like to voice my thoughts about the move today to recommend to the province mandatory vaccination of school-age children with the COVID-19 mRNA vaccine. I have a background in biology and chemistry and a PhD in civil engineering focused on how to design for community sustainability and resilience. And I'm deeply concerned about this issue based on my research. These vaccines are not safe. When I look at the U.S. Vaccine Adverse Event Reporting System, called VAERS, I see thousands of reports. As of September 10th, 2021, recorded were 14,925 deaths, 19,210 permanent disabilities, and more. Some may say that these may not have been caused by the vaccine, but to that I say 57% of the reported deaths occurred within 48 hours of the injection. In addition, we do not know the long-term effects, which is particularly of concern for young children who have their whole lives ahead of them. It is highly questionable to require healthy children to take a vaccine that is clearly not safe. Some may say that it needs to be done to protect them from COVID-19, and yes, it appears that the vaccines can provide some benefit. However, this benefit is not considerable since children are the least vulnerable to COVID-19, which primarily harms those that are older and have comorbidities. The survival rate for those under 19 years of age is 99.997%. Some may say that it needs to be done to protect others. However, from what I can see, these vaccines do not stop transmission. If I look at the England data, and in England they're 100% Delta variant, the number of cases per 100,000 in the population that is fully vaccinated is comparable to the number of cases per 100,000 in the population that are unvaccinated. And you can see table 2 in the UK surveillance report that I mentioned in my written submission. Worldwide, we have seen breakthrough infections. Clearly, these vaccines will not lead us to herd immunity. Many scientists and doctors have questioned the benefit of vaccinating children considering the potential harm. Other governments, too, have questioned this. In the UK, the advisory body has decided not to recommend mass vaccination for 12 to 15-year-olds. I urge the Toronto Board of Health members to not recommend the province require vaccination of school-aged children and to reach out to the many scientists, doctors, and academics that are researching and providing guidance and solutions for the COVID-19 pandemic. I've talked to many scientists, many professors, and today I heard 2 more academics speak about this. So it's from my perspective, I've been looking at a lot of the literature and a lot of the science that they have shared. And
thank you, Mariko.
The report. Okay.
Mariko, thank you. It's your time is up. I apologize. I did give you 30 seconds more to make sure we had some an opportunity for you to complete your thoughts. I'm just going to turn to the Board of Health to see if the directors have any questions for you to seek clarification on your presentation. Directors, if you can let me know if you have any questions, indicate. Seeing none. Thank you very much, Mariko. We appreciate your time. I'm just going to go back to Paul E. Alexander. Paul, are you with us again? We'd like to hear from you if you are. Paul E. Alexander. And final
Vice
call.
Chair, to the Vice Chair, this is the host. Paul E. Alexander has still not connected to the session. However, staff have emailed the speaker to see if they are having any trouble connecting to the meeting.
Okay, thank you very much. Please let us know if he does come back. I think at this point in time, we're going to have to just move on. Are there any questions? We're turning back to the portion of questions to Dr. Davila. Any questions to seek clarification on her report? Starting with Director Cressy, then Director Mulligan.
Well, thank you, Councillor Wong-Tam, and thank you for chairing today's meeting on account of my voice, which, as you can hear, is almost non-existent at the moment. A combination of a childcare cold from my son and perhaps exhaustion as well. To Dr. Davila, just a couple questions. The first is, under the Immunization of School Pupils Act, am I correct in my understanding that 9 vaccines are currently required for those who are eligible to attend school?
So first, can you hear me? Just confirming we're not having technical difficulties.
Yeah, no, I hear you loud and clear, Doc.
Okay, perfect. So through the Vice Chair to you, Councillor, it's actually diseases that are included under the Immunization of School Pupils Act, designated diseases for which proof of the relevant immunization is required.
And is it? Am I correct in that
yes,
there
9,
are 9 diseases
9.
currently proof of vaccination is required?
That is correct, Councillor.
And for the benefit of those of us who don't have school-age children or haven't been in school in a little while, can you give us an example of some of those 9 diseases for which vaccines are required?
Sure. So there are the general vaccines that you'll often get. For those of you who are parents, there's those series of vaccines that you bring your children in for example, when they're in the early months of life. So diphtheria, tetanus, polio. These are just a few of the vaccines. Measles, mumps, rubella, again, are the diseases that are counted, and the vaccines, the relevant vaccines to cover for those diseases are the ones that we're talking about.
Thank you. And can I ask, on what basis are you recommending that the province add COVID-19 as a disease for which a vaccine is now approved be added to that list?
So, essentially what we're talking about is that we should soon have, or we have ability to provide vaccines to a number of students, clearly not all yet, but to a number of students within our population. And these vaccines are demonstrated to be safe and effective and are about preventing disease, quite similar to the other diseases and vaccines that are accounted for under the existing Immunization of School Pupils Act, hence the recommendation that you see in the report in front of you today.
Thank you. Now, can I turn to 5 to 11-year-olds? In your presentation, you, on the long-term projections for cases then and now, it noted an anticipated start of November the 1st.
Sorry, Councillor, I've lost your sound. Is that just me?
Chair, do you have my audio?
Yeah, Dr. Davila, I could hear Dr.
I can't hear Councillor Cressy, nor can I hear you, Councillor Wong-Tam.
Okay, then I believe it might be just
Is that
yourself.
an issue on my side?
Yes.
Oh.
Yeah, we can hear each other, I think.
Might I seek some assistance from the host? I don't hear you at all. I can see you, Councillor, on my screen.
Host, can you provide some support to Dr. Davila?
I will do so now. Thank you.
Thank you. Sorry, Chair Cressy, just hang on tight. After Chair Cressy comes Director Mulligan. Are there any others who wish to ask questions of Dr. Davila? Okay, Director Wong and 2 Director Wongs. Okay, thank you. Starting with Peter, then heading to Sue. Thank you. I might as well just put myself on that list, so there'll be 3 Wongs back to back.
To the Vice Chair, I'm going to attempt to kick and then reconnect Dr. Davila to the meeting via phone. This will take a moment.
Okay, thank you very much. Thanks everyone for your patience.
Hello?
We can hear you.
Okay. I apologize. I seem to be having some serious technical issues today.
That's okay. We'll persevere because we want to hear from you. Director Cressy, Chair Cressy, would you like to restate your last question, please?
Yeah, and Doc, I assume you can hear me fine?
I can now. Sorry about that.
So I just wanted to touch on vaccine eligibility for 5 to 11-year-olds. I noted in your presentation on the modeling an anticipated start date of November the 1st. That I just want some clarity. That is the play. Is that Health Canada approves the vaccines for age 5 to 11-year-olds. So November 1st is when TPH is planning for as soon as that date to roll them out. Is that correct?
So through the chair, what we're trying to do is to make sure that we're ready whenever Health Canada has made their assessment and has provided appropriate approvals for the vaccine. Hence, we're readying ourselves to be ready to go as early as the beginning of November.
Okay, understood. I think that's helpful. And just a final question. The target that has been set out by the Chief Medical Officer of Health for the province and many others of 90% of the eligible population. Do you have a sense, based on the current rate of vaccinations, of when Toronto might be in a position to hit that target?
Through the chair, I think it gets harder and harder as we get closer and closer to the figure because, of course, the pace does slow down somewhat. And with different policy changes, it is a little challenging yet to determine. Perhaps what I might do, Councillor, is come back to you afterwards. At this point, I don't have those data in front of me, but please know, and I would just advise the rest of the board that we are doing everything we can to lower barriers to uptake, to ensure ready access to vaccine, and to make sure that people's questions are answered in and around vaccine and the benefits of vaccination.
Thank you, Councillor Wong-Tam.
Thank you very much. To Director Mulligan, the floor is yours.
Thank you, Chair. Dr. Davila, thank you again for this very comprehensive update. One thing that comes up a lot in the sort of chatter among parents and amongst people interested in public health is around whether COVID can be transmitted in schools. And you provided some evidence today about COVID cases in school-age children that were more likely linked to at-home transmission. Can you just walk us through the evidence that COVID is not transmitted in schools? How should we be thinking about this question?
So through the chair, that's an excellent question to be thinking about. And, you know, I'll be very, very upfront. I think this is something that we are continuing to observe and monitor. And I don't know that there is a singular definitive answer to the question. What I can tell you is that based on the data that we have thus far, it does look at this moment in time like the majority of our cases amongst children are actually demonstrating source of infection being from within the community and primarily the household. We, to date, in this particular school year, have not seen a significant amount of transmission, but it is early days. School just started a few weeks ago, so I wouldn't say that necessarily this won't change. What I am providing to the board is the current state such as it exists. So, of course, we're continuing to monitor, and we will continue to update the public, one, through the board, and two, through our monitoring dashboards, as we have sought to do throughout the course of the entire pandemic. And, of course, we don't have any preconceived notions. We will go where the data take us, and we will report the data as they come in.
Thank you. Thank you so much for that science-based answer, Dr. Davila. I have one more question. It's really more of a comment to thank you and your colleagues in social development for all the work that's been undertaken with community organizations and community ambassadors and very hyper-local approaches. You mentioned that an evaluation is underway. Will this evaluation also consider what is new in those approaches compared to what might have been in place in terms of partnership with community organizations before, and also what you think might be worth holding on to, you know, in a future post-COVID kind of period?
So through the chair, I will admit I'm not familiar with all the granularity that's being contained within that evaluation. That being said, I anticipate that some of those issues absolutely will be, and we expect that there will, and I'm just getting word that yes, they are part of the evaluation. So we'll look forward to bringing that to the board in the next month at the next meeting. We will have to, of course, let the evaluation unfold. It does take some time to collect all the data, and I expect that this will be an issue which we will be discussing with the board for months yet to come.
Thank you. Those are all my questions.
Thank you, Dr.
Thank you.
Thank you, Dr. Davila. Thank you, Director Mulligan. Next to question is Director Peter Wong.
Thank you, Chair Wong Tam. And thank you, Dr. Davila, for your ongoing outstanding presentations. And I really want to thank the staff of the Toronto Public Health for their ongoing tireless work. I know that we really encourage youth to talk to their parents and their, any trusted adult before and, they get their COVID-19 vaccine. But I am aware of several teenagers who actually want to get vaccinated, and their parents and family are very hesitant. And this occurs especially in racialized communities. My question to Dr. Villa is around how can these youth get vaccinated, and under what conditions can they go out and get their vaccine, especially those between 12 and 17 years of age? Thank you.
So through the chair first, thank you for raising this issue. It certainly is an important one and not the first time that we have heard of this particular challenge. A couple of things. First and foremost, from a public health perspective, from a medical care provider perspective, I think it's really important that we encourage families, children and their parents and their parents in turn, to actually have open discussion around vaccine. I think it is important that people, get themselves informed with the facts from reliable sources. And we do encourage discussion between family members in respect of vaccination and the choices that they're making, ideally informed by reliable sources and information from reliable sources. This being said, as you know, when it comes to medical care, young people are able to consent for themselves, right? There is, under the Consent to Treatment Act, there is not a specific age. It is actually a determination that's made at the clinical intervention as to whether the individual is, demonstrates capacity to understand the risks and benefits associated with the intervention that's being proposed. So certainly for young people in our community who are able to present at one of many clinics throughout the city, and a full list is available on our website, they are welcome to have that conversation with the healthcare providers who are offering the vaccine at clinics all over the city. They will be assessed for their ability to provide appropriate consent, as are all people who present to a vaccine clinic. And the determination is made in accordance with good medical practice and the principles of good health care.
Thank you very much, Dr. Davila. Thank you, Director Wong. Our next director to question is Director Stu Wong.
Thank you very much, Madam Chair. I have two questions for Dr. Davila. Before I do ask her the questions, I want to thank Dr. Davila and her team for the past 612 days. I think that we don't know when the end will be coming, but I just want to say acknowledge her good work and as well as her team. I have two questions, Madam Chair, to you to the Medical Officer of Health. The first question dealing with the digital vaccination certificate. Can you share with the board, will this certificate be in multi-language so that our community can access to that certificate? That's number one question. In your presentation, Dr. Davila, on slide number 16, you share with the board that the 30 to 49-year-old age group, only 25% of them are unvaccinated. So my question to you through the chair is, what other strategies should we be looking at to address this age group? Because it is very clear that this population, this age group, are hesitant. So what other strategies should we be looking at to support this age group? Is it information? I know you're going to the mall, you're going to subway stop. What other strategies should we be looking at? Thank you, Madam Chair.
So thank you through the chair first for the kind words for the staff. I know that they're deeply appreciated. With respect to the vaccine certificate and the app that is to be provided by the province, hopefully next month, I think October 22nd is the target date for that. I'll be upfront. I don't have the details yet on that which the province has envisioned for the app. I'm sure they're working very hard to get it done in time to meet that date. And certainly as we hear more information from our provincial counterparts, we'll make that available to you and to the other members of the board, plus our public here in Toronto. With respect to those residents aged 30 to 49 and how best we increase opportunities for vaccination or support their ability to get vaccinated, you're quite right. 25% of the age group is not fully vaccinated. Some of them have not received a first dose. Some of them are in between. They're in the midst. They've got one dose. They don't have a second dose yet on board. But certainly making vaccine as accessible as possible is one of the key components of that strategy. Bringing vaccines to workplaces, bringing vaccines to TTC stations and stops so that it just is part of getting to and from, work, and home and the various locations that people go to. Malls, the mall strategy is certainly another component of that. We are looking at our data regularly, every single week at least. We look at the data, understand where we see higher proportions of the population that have yet to get vaccine coverage and higher numbers. Work with our community ambassadors to understand how best we can reach those populations, and we're constantly adjusting our strategies in keeping with what we hear from trusted partners on the ground and how that works with our data. So please know that we are doing absolutely everything we can, and certainly as vaccine becomes available for a younger population, there may be an opportunity to reach parents at the same time as they bring their kids in as well. So we are exploring all possibilities and are certainly interested in ensuring that we're doing everything we can.
Dr. Davila, thank you. Are there any other directors with questions for Dr. Davila? Director Donaldson, please go ahead.
Thank you. Through you, Chair, to Dr. Davila. And also, I echo the sincere thanks for the 612 days of extreme effort by everyone at TPH. My question is about the TPH support for schools slide, specifically the take-home testing kit program. So, Dr. Davila, I'm hoping that you can provide some additional insight to the board on this program, who the partners are, what lower barrier means, and specifically if the program's available for staff, students, or both, please. Thank you.
So through the chair first, thank you for the question. And I'm sure I'm about to forget a particular hospital, and I'll leave it to my colleagues to correct me if I am wrong. So we have a number of hospital partners in particular who are helping us with the take-home testing kit program. The notable partners being the Hospital for Sick Children, Michael Garron Hospital, and Women's College Hospital. These are the key partners that we have. They do much of the heavy lifting in respect of the hospital side of this work. What we are doing is making sure that these are available in those circumstances where there are, for example, exposures to known cases. The focus, as I understand it, is primarily on students, but I will have to refer to my staff to ask them about whether teachers and staff are also included within that program.
Thank you. Director Donaldson, do you have a follow-up question?
I don't. Thanks, Chair.
Thank you. Anyone else with questions? I think we almost cleared the board. Dr. Davila, I have a couple of quick questions for you. With respect to comments about, myocarditis and it being found as a sort of a possible side effect for young males. I was just reading this Guardian article myself. How likely is that a prevalent thing, or is that just a 1 out of 10,000 potential side effects? Like, how serious is this?
So, to answer your question, certainly incidents of myocarditis and pericarditis are not the kinds of things we want to see for anyone, and especially amongst young people. But with, being respectful of the time of the board, I would say this. This is, a known issue with respect to vaccines, the mRNA vaccines in particular, and it is exactly why there is post-licensure surveillance when it comes to vaccines. So the fact that we actually have observed this is evidence of the safety system that is in place for vaccines working. I think it's really important that people appreciate that. And then what that allows is for medical providers and for members of the public to, one, be informed as to the possibility of that occurrence, to look for signs and to seek early treatment such that when and if it does occur, people are clear about what intervention is required in order to mitigate any risk associated with that. I think the other point that's perhaps really important, and I would like to emphasize for members of the board, is that when you look at infection with viruses like COVID-19, and including COVID-19, it's actual infection with COVID-19 and other viruses that actually gives rise to a much higher risk of issues like myocarditis and pericarditis. So when I look at the data overall, and when you look at the advice that is being provided by public health authorities the world over, it is, of note that, that is why we are all recommending for the safety and effectiveness of vaccine. We have seen the benefits of vaccine, the protective benefits of vaccine for us as individuals and for the communities and people around us. So I can't emphasize enough that, there is, yes, there are side effects associated with vaccine, most of which are local and short-lived, and that the overall protective benefit of vaccines warrants their continued use.
Thank you very much, Dr. Davila. I'm also out of time now. Any members from the board to speak to the item? Starting with Director Cressy. Go ahead, please.
Well, thank you. I can begin first by moving the staff recommendations, which includes the medical officer of health's request for the province to add COVID-19 to the list of diseases that require vaccinations under the Immunization of School Pupils Act. I also have two brief amendments. The first, at the request of the medical officer of health, if clerks can place this on the screen, this is at the Dr. Davila's request to amend recommendation 1 on the monitoring of the vaccine certificate to say City Council, as well as the Board of Health. And the second, and this was in collaboration with Director Mulligan, is to request the medical officer of health in consultation with the Deputy City Manager for Community and Social Services to review the cross-sectoral response to COVID and to report back specifically on the successful strategies employed with our Equity Action Plan and the vaccination campaign, to consider the role of the City and TPH in addressing the social determinants of health, and to look towards recommendations to transition some of the emergency response initiatives that worked really well into permanent programs to improve health outcomes from a cross-sectoral lens. I will just, on account of my voice, be very brief here. First, to thank our staff for 612 days of steady, compassionate, and strong leadership, especially to Dr. Davila and the entire 2,400 strong TPH team. And then 3 points that for all of us, now is a moment to remain cautious while we are optimistic. Secondly, that we need to continue breaking down barriers to reach everyone everywhere in our drive to 90% overall vaccination rates. And third and finally, that let us ensure that we use the lessons that we have seen and the inequities that have been exposed during this pandemic. Let us use those lessons and those as an opportunity to fix these inequities, to right these wrongs. We have done remarkable work to address those inequities during the pandemic. We must carry those lessons forward to create better systems permanently. With that, I'll turn the floor back to you, Councillor Wong-Tam. Thank you.
Thank you very much, Chair. Anyone else to speak to the matter? Go ahead, Director Donaldson.
Thank you, Chair. I'll be quick. Just on the point of the recommendation to request the province of Ontario to require COVID-19 vaccination for students who are eligible, I just wanted to let the board know that many in the education sector have been advocating also to the province for this, including the Ontario Public School Boards Association and the Toronto District School Board. So grateful to see the Board of Health add their voice to the advocacy as well. Thank you.
Thank you very much, Director. Anyone else? I would just also take a moment to speak very briefly. Thank you, Dr. Davila, for your presentation to the deputants who came out to speak today. I want to flag one thing, and I'm still trying to understand how this is going to be developed. It's an ongoing conversation about consent. Many of you will know that my spouse is a consent educator. She's a subject matter expert. And oftentimes we talk about consent at the table, dinner table, and other places. And lately we've been having conversations with parents in the playground, parents who are dropping off their kids at the daycare, and that conversation is evolving. And I think more and more people are turning their attention to, how do parents make that decision on behalf of their children? If their children may not be able to consent. And I do recognize that it's, we don't want to necessarily take things too literal, but at the same time, I do flag it that there are probably a host of questions that we need to be ready to respond to. And I didn't necessarily move it as a motion, but I'm hoping that Dr. Davila, because you do appear before the Board of Health monthly, you give us a very great detailed explanation of all the work that the Board of Health the Toronto Public Health staff have been doing. I'm wondering if moving forward, if we can have some of that information coming back to us in further disaggregated forms. So especially when it comes to the vaccine passport implementation process, if we could probably see more reporting out based on incidents of age. How is that taking place? How is that conversation evolving? And I do recognize that if we're going to be providing, good information made available to the public, we have to be really ready to show data, ready to show all points of view. And I'm of the mindset that the more information people have, the more we're able to have a respectful and I think a very informed dialogue. But this issue is very real. Dr. Wong did also specify it in terms of those who may be vaccine hesitant, or children that are young people that are ready to be vaccinated but parents may not be, or perhaps young people aren't being ready to be vaccinated but parents are. And so then who pulls the levers and who actually has the final say, and then who bears the responsibility, I would guess, if something does go wrong. And I know that this is a really emerging conversation. I just want to be mindful that it is happening in daycares and in schools, and just to acknowledge that there are a whole host of questions that are that parents and caregivers need to have the answers to, and I think it's our responsibility to provide it to them. My 27-month son seems to have a runny nose all the time. Ever since we started daycare, I can't stop his nose from running. I can't get a cold medicine for him. Apparently, it doesn't exist for children of that age. You got to be 5 and up in order for you to get cold medicine. And at the same time, right now, he's at home because I can't send him to daycare because he has a runny nose, and it's been 4 days ongoing. And I've already taken him in for 2 COVID tests. Every single time it runs negative, but then he goes back to daycare. He comes back with a runny nose, and there is no rapid testing. So I think that we need to be able to really get into the granular details to explain to parents as well as caregivers what to do, what their options are. And as far as I can tell, my 27-month son is not going to have a vaccine option that's safe to him anytime soon because he can't even get cold medicine. So I put that out there just for some thinking, and I want to say thank you once again to everybody. I realized I ran my own clock, so I apologize for taking a little bit longer. Thank you. We do have the motion in front of us from Chair Director Cressy. Should we take it as a package, everyone? All those in favor, indicate your support. Any opposed? That carries. And item as amended, all those in favor, anyone opposed? That carries. Thank you. Okay, we're moving on to item number 2. Item number 2, advancing the implementation of the Toronto Indigenous Health Strategy at Toronto Public Health. We do have staff who are here to provide us with some introductory remarks to this item. Please go ahead. I believe we're hearing from Dr. Davila first.
Yes, thank you, Councillor. I'll just be brief, recognizing our time constraints. You have in front of you a report that starts off by talking about the ongoing impacts of colonization and the ongoing experience of inequities with a number of health outcomes that is the reality of many Indigenous peoples here in Toronto. Addressing health inequities, reducing health inequities is one of the core objectives of public health. And it is with this in mind that colleagues here at Toronto Public Health worked a number of years ago with colleagues at what was then known as the Toronto Central LHIN and with key leaders within our Indigenous communities here in the city to support the development of the Toronto Indigenous Health Strategy. The purpose of the strategy is, of course, to reduce those inequities and to ensure that the Indigenous peoples here in Toronto have the opportunity to start life off healthy and to stay that way for as long as possible, which also is one of the key objectives of public health practice. And some of the recommendations under the strategy are to do such things as enhance cultural safety amongst our programs and services, to strengthen partnerships with Indigenous communities, to advance Indigenous health and reconciliation through a public health policy mandate. So in order to advance those objectives, at Toronto Public Health, we've undertaken a number of activities, the most recent of which is bringing on a new staff person to help us see our way through this work. Again, just a beginning, but an important one. So it is with great pleasure and pride that I introduce to the Board of Health one of our newest staff additions, a senior policy advisor to help us specifically undertake this work, and a member of one of our Indigenous communities here in Toronto, Melissa Stevenson. So with that, Melissa, welcome. I am very happy to introduce you to the members of the Board of Health, and we'll look forward. I'll turn it over to you to say a few words.
Miigwech, Dr. Davila, for such a lovely introduction. Tanse, Melissa Stevenson, Mimi Sinakasan, Pegas First Nation Ochi, Upcheast, Mimi Hinoan. So I start in the Cree language, which is the language of my late grandmother. And I do this in a way so that I can ground myself in her spirit and in the spirit of my ancestors, because honestly, without their strength and resilience, I wouldn't be here today. I also want to add by saying Miigwech to Creator for honestly leading me to this exact moment. for giving me all these options and choices in my life that have really brought me to this space where I'm here with you guys today to introduce myself. In that same breath, I also want to acknowledge spiritual and living beings that have been my teachers and my helpers over the years. They have been a part of every moment of my life. So with that, I say, Chimiguch Gitchimanato. So for me, again, this is beyond a simple introduction of who I am and what I can bring to this space within public health. But rather, I really want to acknowledge this important first step, which is an important step for TPH as well as the City of Toronto in our continuation of working towards reconciliation with our community. You know, I will highlight that an important piece that I'm sure many of you heard over the years, again, it's the idea or the notion that nothing about us without us. So again, I'm really hoping that this will be the first of many Indigenous-based positions that will be within Toronto Public Health. Again, highlighting the aim of my work, it's really to apply my Indigenous lens to the work that's being done within the prevention and strategy team, but also within TPH overall. The passion for my work honestly really lies in advocating for traditional healing and culturally appropriate services for our community in a way so that we can heal. I really honestly see spiritual healing as being a vital component to being able to understand how to care for our physical self. And it is through our teachings and our ceremonies that we'll be reminded of our sacredness. And honestly, we'll be given that opportunity for that minimum, which is the ability to live that good life. And so to end, I just want to say Chimiguch, and I'm very honored and grateful to be here with you all today. And I look forward to our work as we move forward.
Thank you very much, Melissa, and thank you for addressing the board. Are we hearing from Selena Young as well?
Thank you. Sorry, button issues. Greetings, Tassi. Marcy for having me, chairs and members of the board. Dr. Davila, I really appreciated the invite just to share a few words in Eskimo. I also want to say, as someone whose family is deeply impacted by residential and day schools, I greatly appreciated the words you shared, Dr. Wong, and helping this meeting and this week start in that good way. Indigenous health is always on my mind and in my heart as an Indigenous woman and also as the director of the Indigenous Affairs Office of the City of Toronto. So Dr. Davila thought it would be timely to share a bit about the role of the Indigenous Affairs Office in our collaborative work. I'm just going to say a few things and try and be as brief as possible, as I know time is of the essence. So the Indigenous Affairs Office has both an external and an internal function. Externally, we work with the large and diverse First Nations, Inuit, and Métis communities of Toronto, as well as the incredible organizations that support them. We are advocates, navigators, and facilitators for those Indigenous communities. Internally, we support all of the city divisions to work in better ways with the Indigenous communities in our collective effort to advance truth, justice, and reconciliation. And of course, working with Toronto Public Health is critical. Working with community is absolutely critical. And we know, I think all of you know, the systemic racism that Indigenous people face in the healthcare system. We know the impact of food insecurity and housing, the need for education, access, economic stability, connection to community and culture. And so we have an opportunity to work with Toronto Public Health to breathe renewed life into Toronto's Indigenous health strategy. Melissa is an incredible, as you I'm sure just gathered, an incredible addition to the team to support a thriving and healthy urban Indigenous community. And we will work with Toronto Public Health and, importantly, community and Indigenous. And I'm sure you will be along with us on that journey. So, Marcy, thank you.
Thank you so much to everyone who spoke, and thank you, Selena. Thank you, Melissa. Thank you, Dr. Davila. Do we have any questions of staff on the report that's before us? You just indicate your interest in asking questions? No? Okay. Members to speak. Councillor Layton, go ahead.
Yes, thank you very much. Madam Chair, and to our Medical Officer of Health, thank you for bringing this report forward. Having spent the last 10 years on the Indigenous Affairs Committee here at the City of Toronto, it finally feels like things are really moving, and that the necessary resources are being applied to the various commitments we've made over the years. I once had a conversation with a member of the committee who said quite openly, we have enough reports on these walls to fill a bookcase. So we have enough reports to fill a bookcase. What we need is the actionable items. You have some of that here, which is really a very positive step. And I thank you very much for your hard work, and of course to Selena in our Indigenous Affairs Office, which was one of the commitments that the city made in putting one of those report recommendations into action, and we will continue to do so, along with the not only from the statement of commitments made to Indigenous people of living in Toronto prior to the TRC recommendations and calls to action. We're going to fulfill these, and it has taken some time, but the momentum is there now. I would like to offer a welcome to Melissa to the team. That's very exciting that we'll have someone embedded within the Board of Health or Toronto Public Health in order to advocate for these strategies and ensure we implement them and they're successful. And so this is a very exciting moment, I think, for it should be for this board, and I thank you all for your hard work in taking it this far.
Thank you very much, Director Layton, Councillor Layton. Director Mulligan to speak.
Thank you, and I realize I probably should have put this in as a question, but I'll put it in as a comment instead. I would love to hear from you now and going forward about what the role of a Board of Health can and should be in supporting you in this work. And I look forward to your leadership in holding us accountable and pushing us forward so that we are doing our utmost to help you and support you in the work of advancing Indigenous health and Indigenous hands in our city. Thanks.
Thank you so much, Director. Anyone else? Okay. Director Cressy.
Just briefly to say, first of all, a welcome to Melissa, of course, but just how important it feels that as a city and as a board to move from words to action, to embed the work of Indigenous health in our mandate and in our staffing structure. And what an important step forward that is. And that the Indigenous health strategy is more than a strategy on a shelf. Rather, it is a living and breathing document that we will continue to contribute to adjust and to improve. And I look forward to that work carrying forward. And Melissa, I look forward to us doing what you tell us to do, because that's exactly what we will do.
Thank you very much. Anyone else? Seeing none, I'm just going to move the recommendations in the staff report, and of course, just to lend my voice very quickly to echo all that has been said. This body of work, I think, is critically important. As a councillor who represents the Downtown East Ward 13, we have the largest number of Indigenous organizations and agencies that are there. Many of them have been working very hard and diligently in trying to keep communities healthy and safe, and having a strategy that will guide their work, make sure it's coordinated and well communicated, and most importantly, supported and well resourced, I think is going to make a big difference. Toronto is already home to about 70,000 Indigenous people. That makes us one of the largest Indigenous communities, populations off reserve. And I think that, not only is the strategy overdue, but we want to make sure that the work is supported, resourced, as I mentioned, but I think measuring outcomes and benchmarks so we can see progress year over year is critically important. So thank you very much, everyone. And I look forward to our presentation at the board in 2022. Anyone else to speak? Seeing none, all those in favor of the recommendations in the report? Any opposed? That carries. Thank you. Fantastic. So we are moving on to sorry, folks, you're so patient. Oh, yes, of course. Item number 5, Association of Local Public Health Agencies, Alpha update. We're going to hear from Director Mulligan. Director Mulligan, the floor is yours.
Thank you, Chair. I'll keep this really brief because you do have the most recent Alpha information break in your package, and you should have received it in your email last week as well. I'll just highlight a couple of things. One is to hold the date for the Alpha Fall Symposium, which will be held on Friday, November 19th. And there's always at least one very informative and very pragmatic and practical session geared to boards. So it would be worth your while to hold that date if at all possible. More information about the symposium will be coming pretty soon. There is also a shared resources page on the Alpha website with lots of practical information for boards of health around issues like liability, roles of the board, and so on. So do have a look at that as well. Just wanted to flag for you that increasingly Alpha has been working with the Dalla Lana School of Public Health. They've released a white paper about a learning health system and a learning public health system. So if you want to know more about how public health systems can learn from feedback and data, you can check it out. And there are a couple of upcoming events this week worth noting. One is today at 4. So in a few minutes, really, health equity and transformation through community advocacy at the Dalla Lana School of Health online. And then on September 30th, Honoring Truth and Reconciliation Day. So you can find all of that in the Alpha information break. And this will be my last Alpha update. And this is my last report back from the Alpha board. And I look forward to supporting Director Donaldson as she takes on this new role. Thanks.
Thank you very much, Director Mulligan. I'm sure I can say on behalf of the entire board, thank you for all that you do. Thank you for your regular updates. And of course, I know that although you may not be the official designated person anymore, you'll be monitoring still very safely and carefully. Welcome aboard, Director Donaldson. We will congratulate you as soon as we can take a vote. If there's no one else, any questions, I should get back to procedures. Any questions of Director Mulligan from her presentation? Seeing none. Okay. Then we just have the simple motion on the floor from Councillor Cressy. You have a motion to, actually, do you want to move your own motion?
Yeah, this is, as Kate mentioned, after 3 strong years as our rep on the Alpha board, Kate is taking her immense energies elsewhere and stepping aside. And so the motion in front of us here is to accept, sadly, Kate's moving on from the Alpha board and to move to appoint Trustee Donaldson to try and fill Kate's huge shoes at that board. So I'm happy to move that motion, and please join me in a little silent round of applause for Kate for all of her hard work.
Thank you very much. Thank you. All those in favor of the recommendation in the letter? Any opposed? That carries. Thank you. Congratulations, Director Donaldson, and thank you very much, Director Mulligan. We are heading to HL 30.6. It's a very long title. 2021 Board of Health Resignation Appointment to Association of Local Public Health Agencies, Board of Directors, and Board of Health section. Let me just get to that. Sorry, I'm working with a lot of screens. I thought we just dealt with that matter. Oh, I see. We should have received Director Mulligan's report, correct?
That's right. If you could receive, that would be item number HL 30.5, just a motion to receive on that matter. And then I believe you dealt with the chair's item HL 30.6 just a minute ago.
Yes, thank you very much for that clarification. I accidentally merged both items together. I was so excited. If we can just, I will move to receive Director Mulligan's report. All those in favor? Any opposed? That carries. And then our last item is HL 30.7, request for review of the health impact assessment for the Ontario line. Just opening this up, we have a letter from Councillor Cressy. Councillor, do you want to just quickly introduce and speak to it?
Delighted to. This is on behalf of Councillor Paula Fletcher, and this is a request for the Medical Officer of Health to review the local health impact assessment that has been produced by the South Riverdale Community Health Centre. regarding the Ontario line in Riverside Leslieville, and to request Metrolinx to extend the commenting period to allow that review to take place. So on behalf of Councillor Fletcher, I'm happy to move those recommendations in the letter.
Thank you. And I think that's self-explanatory. Any questions of the mover? Seeing none, all those in favor? Any opposed? That carries. That brings us to the end of the agenda. Thank you. We wrapped up very quickly. Just to clerks, are there any members of the Board of Health that we need to vote to excuse for their absence?
Ms. Vice Chair, we only do that for council advisory bodies, the motion to excuse. Yeah, okay. So we are fine for this Board of Health meeting. Actually, all Board of Health directors were present at some point of the meeting today.
Excellent. Okay, so then thank you very much, everyone. Thank you for your time today. I think that brings us to the end of our meeting then. Okay, great job all. Thank you.